visit. How is your wife behaving before?
Frantic.
She was frantic.
Yeah, she was trying to figure out everything. She didn't know, was researching stuff she did not know. Probably typical.
In this video, we'll be discussing first, second, and third trimester prenatal care. We'll talk about what to expect at your visits, labs, and tests you might have, and the frequency of visits you'll want to make with your provider. Nearly everyone has first appointment jitters. Put those jitters aside, you've got this. At your first appointment, expect to answer a lot of questions from your nurses and providers. While it might feel like the third degree, the answers to those questions are helping your doctor formulate a plan for your care and for baby care too. Answer honestly and communicate openly about all the questions you're asked. After the many questions, you'll have a physical examination. Depending on how far along you are in your pregnancy, various things may happen. You will have your blood pressure, pulse, temperature, and weight checked. You will likely have a pelvic exam to determine the position of your cervix. This will come into play during labor and delivery. You'll receive a large amount of information during this visit. It might feel a little overwhelming, but you can always ask questions if you are confused about anything. Some things you might discuss are nutrition, weight gain or loss during pregnancy, physical changes you might experience, the baby's development, and how to take care of yourself. There will be some tests that the provider will likely order during your first trimester. You'll have blood tests such as blood type and Rh factor and a urine test. You can obtain a list of all the tests done during the first trimester from your provider. Every pregnancy and person is different and may require different testing. It's possible that your provider may do an ultrasound to calculate a more accurate due date. You'll probably have just a few appointments during your first trimester. 1 or 2 visits is typical, but this depends on your pregnancy, provider, and you. If you have any concerns, you can always call your provider and set up an appointment. During the second trimester, your appointments will be scheduled every 4 weeks. Exciting things are happening, and now you're starting to feel and look pregnant. You'll probably even start birthing classes during this trimester. At each visit, you can expect to answer some questions about how you're feeling, physically and emotionally. It is important to openly communicate with your provider about your emotional well-being, because this affects baby too. Be sure to communicate any feelings of sadness, stress, fear, or worry. The provider and nurse may be able to help answer questions and work through some of those feelings with you. You'll have a physical exam and pelvic exam if needed at each visit as well. You'll receive more information about how to care for yourself and baby during this time. Information about nutrition, growth, and physical changes that will take place in your body, as well as changes occurring with baby. Weight will likely be a point of discussion, and you'll receive guidance on how much weight you have gained and how much more you will gain throughout the pregnancy. Labs and tests are an important part of caring for you and baby during pregnancy. Make sure you follow through with appointments for labs and tests. During the second trimester, these are some tests that will be ordered to ensure everything is progressing healthy with you and baby. A triple screen or quad screen. This tests for neural tube defects and trisomy 21 or Down syndrome. These are routine tests and do not mean anything is wrong with your baby. You'll have a full-length ultrasound around 20 weeks, a test for gestational diabetes between weeks 24 and 28, and last but not least, you will have a urine test at each visit. Things are starting to get busier now. In the third trimester, you'll have appointments every 2 weeks until you reach 36 weeks, and then weekly until 40 weeks. If baby still hasn't come, twice-a-week appointments until labor begins. There will be many things to discuss with your provider during these visits. One of them is your birth plan. This includes your expectations for labor and delivery, medication options, and birthing center tours, and any questions, concerns, or fears you might have about labor and delivery. At each visit, you'll have a physical exam that will include listening to the baby's heart rate and assessment of their movements. A pelvic exam will be performed to determine the status of your cervix, checking for the softening and dilating of the cervix preparing for labor. The provider will pay special attention to your blood pressure, pulse, and check carefully for any swelling. Labs and tests you will have during the third trimester include a Group B strep test. This will determine if you need antibiotics during labor to help protect your baby against infection. Additional screenings may be performed depending on the results of previous screenings and tests. An ultrasound might be done to determine the position of the baby and to determine if they are headed in the right direction. You'll need to give a urine sample at each visit too, but believe me, you'll be ready to go. I hope you enjoyed this video and that you have an idea now what to expect in your prenatal care appointments. Remember that each pregnancy is different and you will likely experience many things you never have before. Be sure to communicate your questions with your provider and nurses. They're there to help you through this amazing life moment. Happy pregnancy!